Hello, my name is Jessica Berg, and I'm an occupational therapy student at Washington University in St. Louis. Today, we are going to be talking about COVID 19, the impact it has on family caregivers post stroke, and supports that are in place for caregivers during these unprecedented times. First, I wanted to give an overview of what COVID 19 is and how we all can prevent the spread in order to keep our loved ones and community safe. The novel coronavirus, also known as COVID-19 or SARS-CoV-2, is an infectious disease that can easily be spread through respiratory droplets from coughing or sneezing from person to person in close contact. This typically occurs within 6 feet. The incubation period of the virus is typically 2 to 14 days before symptoms emerge. Researchers have pinpointed that average time is 5 to 6 days post-exposure. Older adults and people who have underlying health conditions, such as stroke, are most at risk for developing serious complications, hospitalization, and in some cases, death due to the onset of the virus. Most individuals will experience mild to moderate respiratory illness and will not require medical intervention or hospitalization. Symptoms include fevers or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. There are ways that we as a community can help prevent the spread of COVID-19 to keep ourselves and our loved ones safe. The CDC recommends that you wash your hands often with soap and water for at least 20 seconds. When hand washing stations are not available, use hand sanitizer that contains at least 60% alcohol. Also, avoid touching your mouth, eyes, and nose when you can. The CDC also recommends to avoid close contact and abide by social distancing rules, staying at least 6 feet apart from others that are not members of your household. You should also clean and disinfect commonly used and touched surfaces frequently. As the nation gradually reopens, it is extremely important to wear a protective mask whenever out in public. Cover your mouth and nose with your cloth cover or mask when in public places or around others not in your own household. Remember to stay social distance even with a mask on. Cover coughs and sneezes with a tissue or into your elbow. Immediately discard of the tissue in the trash and wash your hands or use hand sanitizer. Lastly, for COVID-19 prevention, monitor your own health. Be alert for symptoms, take your temperature regularly, and follow the CDC guidelines if symptoms develop. As a nation, restrictions are slowly lifting. However, there is still a great risk when venturing back into the community, and for some high-risk populations, this is still not an option. Thus, high-risk populations, such as stroke survivors and their loved ones, must prepare for quarantine and more time of shelter in place. In order to prepare for this, several suggestions have been given by experts. First, put together a network. Have friends and family available to run errands and provide some caregiving tasks if needed. Utilize technology to communicate with friends and family. Send letters, cards, and notes back and forth too. Lastly, plan ahead. Know who will care for your loved one if you become sick. In order to create a physical map of support for you and your loved one that can be easily accessed when you need it, a great resource is at atlasofcaregiving.com and the link provided. It is vital that you have supplies at the ready. Make sure that you have ample amounts of supplies, food, and medication. For caregiving supplies and food, it is recommended that you have enough for 2 weeks. Also, take advantage of telehealth and have medication stocked as well. If you are able, ask your provider to switch to virtual visits if the office is not already doing so for certain appointments. This will limit exposure for you and your loved one. It is also recommended that you have a 30-day supply of the medications you and your loved one needs. If this is an issue, talk to your pharmacist and explain the situation or contact your doctor. During this time of uncertainty and change, it is important that we all stay connected. It is so important that you also maintain self-care and safety for yourself and your loved one. Make sure you are limiting visitors in person for your safety and your loved one's safety as well. Lastly, make sure you are taking care of yourself during this. Take time for yourself and do things that you enjoy in a safe manner. In the unfortunate event that you as a caregiver happen to test positive for COVID-19, stay home, unless medical care is needed. If you develop trouble breathing, confusion, inability to stay awake, bluish lips or face, or pain/pressure in the chest, go to the emergency room immediately. In the meantime, get rest, hydrate, and take acetaminophen to help reduce your fever. It is important that you stay in touch with your healthcare provider as well. It is also recommended that you separate yourself in the home from people and pets. However, as a caregiver to your loved one, that can be something that may seem impossible to do. In this instance, it is important that you have a plan in place for who will care for your loved one if you as the primary caregiver do test positive. That way you can focus on your own healing and well-being. Research has shown that caregivers often disregard their own physical, social, and mental health while they focus on the relative with stroke, thus missing doctor's appointments and failing to adhere to medication regimens, which can result in a lowered immune response, slower wound healing, and higher risk of chronic illnesses. Thus, it is so important to take care of yourself too. Make sure to monitor your symptoms throughout the process. Until you test negative for COVID-19, abide by these precautions, as well as those utilized to reduce the spread mentioned earlier. In the event that your loved one tests positive for COVID-19, provide the necessary supports and care while keeping yourself safe. Adhere to healthcare professionals' instructions, keep your loved ones hydrated and comfortable, and if you notice your loved one's symptoms worsen and are life-threatening, contact 911 immediately or drive them to your nearest emergency room. Limit contact with the outside world, meaning no visitors, and if you are able, have a friend or family member run errands and provide supplies for you. This will allow you not to have to venture out into public or leave your loved one alone. Also, avoid sharing items. Avoid sharing bathrooms, rooms, food, and anything else that could transmit the virus. It is important to always have your loved one wear a mask when they are around you and you are providing care. During your caregiving tasks, make sure you are wearing gloves and your own protective mask as well. Practice good hygiene and wash your hands, disinfect surfaces, and avoid touching your face. Wear gloves when you have touched anything that your loved one touches or wears and dispose of them properly. Make sure you are tracking your own health too. It can be too easy sometimes to get caught up in your loved one's affairs and not care for yourself. Remember, you are an essential part of the caring process for your loved one, as well as an essential person to your family, loved ones, and friends. Frankly, everyone is at risk for developing COVID-19. However, research has shown that certain groups of people are more vulnerable to developing serious complications, hospitalization, and even death from contracting the virus. Even if individuals do not directly contract the virus, the ramifications of shelter in place and social distancing are still creating many issues for people of all walks of life, some more so than others. Stroke survivors are a group that are at a much higher risk than the general public. Research has suggested that individuals who have had a stroke previously are at a higher risk for serious complications related to COVID-19. The advice that the CDC provides should be followed extra carefully. Stroke survivors should avoid leaving their homes when possible, have friends or family run essential errands for them, and limit physical contact with the outside world. It is also important that stroke survivors should continue their prescribed medications, exercise programs, and activities carried out in the home. Caregivers and stroke survivors should be aware that certain symptoms that may arise for stroke survivors are worsening of baseline neurological functioning, which is not common for the general public. If this occurs, caregivers should immediately contact medical help. Caregivers are also at a high risk, not only to contract the virus, but to develop physiological and psychological complications during the stay-at-home order and quarantine due to increased time spent caregiving. Caregivers caring in the home are not always equipped to follow various precautions if their loved one develops COVID-19. There is already a shortage of PPE, and sharing rooms, bathroom, and household items are more common in the home environment than the hospital, putting caregivers more at risk. Caregivers should also be aware of their own risk factors. A hormone called cortisol has been seen to be released in excess in caregivers post-stroke due to the demands and stressors of caregiving. Ongoing release of this hormone, induced by high levels of stress, can lead to a weakened immune system in caregivers, as well as other physiological repercussions. Caregivers should be aware and take the necessary precautions. If a caregiver is in a high-risk group, they should be diligent about following the CDC guidelines in and outside of the home. Caregivers also already experience strain while caregiving, both physical and emotional. This can be exacerbated by the lack of social participation, isolation, and increased allostatic loads placed on them that can compromise their physiological health outcomes due to COVID-19. These outcomes can lead to chronic conditions of their own or injury. Social isolation is also a detrimental side effect arising from the stay-at-home orders, and even after restrictions are lifted, at-risk populations who fear entering the community again may continue to stay isolated, as previously mentioned. Social isolation can lead to increased cognitive decline in caregivers, as well as depression and anxiety. Family caregivers post-stroke are already at risk for social isolation, burden, and depressive symptoms, which can be exacerbated with quarantine and the increased time spent in the home. Family caregivers also already experience a restricted occupational role in which their surroundings can be less stimulating, with decreased social participation. Studies have shown that lack of cognitive stimulation can impact cognitive functioning of caregivers. Depression or depressed mood in caregivers can influence their own cognitive decline and problem solving and memory, which is vital for the execution and safety of their own everyday occupations, most notably the occupation of caregiving. Unfortunately, due to social isolation, increased time spent in the home, and decreased outside help resulting from COVID-19, it is likely that caregiver burden will increase for many caregivers post-stroke. This results in less time spent on valued activities and more time spent on caregiving, which can lead to decreased quality of life, injury, and caregiver burnout. As it has been mentioned, caregiver burden is likely to be amplified during the COVID-19 age. Also, given the current spike in cases, we will likely see a pause in community and public activities. In the next few slides, I will outline how COVID-19 amplifies some negative aspects of caregiving. Caregivers and their loved ones are experiencing increased social isolation, as they are not able to travel outside of their home for social participation or allow guests and visitors to enter the home. This increased isolation, as mentioned previously, can be detrimental to caregiver health and well-being, as they spend more time in the home caregiving and less time in the community socializing and enjoying valued activities. There is also the chance that decreased outside assistance will be obtained due to supportive services being shut down or the fear of exposure when allowing other caregivers into the home. This decreased outside assistance can lead to more hours caregiving, resulting in increased risk for injury, development of chronic conditions, decreased sleep and sleep quality, and decreased quality of life in general. Injury can also lead to the inability for the caregiver to care for their loved one, resulting in institutionalization. Psychological issues are also common for caregivers post-stroke as they adjust to the new normal. This can be amplified during the pandemic as supportive services, social supports from family and friends, and valued activities of the caregiver come to a halt. The pandemic adds on extra stress as caregivers may be working or caring for their own family during this time as well. Certain caregivers may not have the type of job where they can stay home and isolate, increasing their fear and anxiety surrounding the spread of the virus to their loved one. Decreased access to necessities such as medication and supplies for caregiving can be amplified during the COVID-19 pandemic, as traveling out in public places is more difficult for those who are caregiving for their loved ones, especially if they are unable to take them out in the community with them and they are unsafe to leave at home. Access to medical care may also be limited as well. As the world and nation as a whole transition to telemedicine, certain caregivers may not have the resources to facilitate that. There may also be fear in entering medical facilities with their loved ones for important appointments, resulting in missed appointments. It is important that all necessary appointments are being attended in order to keep you and your loved one healthy. Transportation may also be limited during this time, and fear surrounding public transportation for caregivers and their loved ones is common. This further limits access to care. Respite care options and other supportive services are also being closed during the pandemic, putting an increased strain on the caregiver population. Without respite care options, it can be difficult for family caregivers who are working or caring for their own household separately from their loved one to carry out those duties effectively. Without proper supports, caregivers may have to cut their job hours or quit their job altogether, resulting in financial strain. During the age of social distancing, it is important to care for yourself, seek supports, and know what supports you have in place. Maintain your lifelines. Keep in contact with your friends and family. Utilize video chats, emails, the telephone, and text messages to stay in contact and reach out if you need any assistance. Also, create separation from you and your loved one. Take time for yourself, whether that be in a separate room or in the same room doing something you enjoy or something that you both enjoy. There are also some online respite care options that will match you with a paid caregiver who will stream a movie or do an activity with your loved one via an electronic video device, so you are able to separate yourself and get something else done or enjoy some leisure time. During these uncertain times, it is also important to share mutual enjoyment. Take this time to do something in the home that you both enjoy together. This could be watching a movie, doing a craft, reminiscing through old photos, or anything else that you both enjoy in the safety of your home. Make sure you are stimulating your brain and staying active. Research has demonstrated the importance of caregivers taking time for themselves and the benefits. It is important for caregivers to take time for themselves to avoid role engulfment, loss of self, and maintain valuable social connections, especially during the COVID-19 pandemic. Taking time for themselves decreases caregiver burden and increases their quality of life. It is important that caregivers are aware of the different supports they can tap into in order to stay home safe and mitigate some caregiver burden. There are respite care options available in the KC and Overland Park area that can be found at the websites noted. In order to search for respite care options, simply find the state you want care in and type in the city or zip code and options will appear. The options that appear will go into more detail as you click on them, so that way you can find the one that suits you and your loved one the best. Home Watch Caregivers is also a local respite care option in the KC and Overland Park area with caregivers specifically trained in stroke care. There is also a link with helpful tips on how to pay for respite care, especially during these times where money can be tight due to job restrictions, loss, or other unexpected expenses. During this time of social distancing, it is completely understandable that caregivers and their loved ones may not feel comfortable leaving their homes to travel into the community. However, it is vital that caregivers receive social supports and social participation during this time. There are online support groups and forums that can be accessed from the comforts of home where caregivers can connect with other caregivers to chat, ask questions, and seek supports. The groups and forums can be found at the websites included. Facebook groups are also good places to seek supports and connections between caregivers across the nation and world. Here are some more options for online supports to utilize during COVID-19. The Family Caregiver Alliance, American Stroke Association, Elder Care Locator, several guides, AARP, and the Caregiver Action Network are all great resources. Also, there are options to find online stroke support groups as well as in-person ones when it is safe to venture out of your homes as well in the link provided. Each of these online supports also have links to helpful information for caregivers during COVID-19 on their websites. All of these supports will also be converted to a handout for easy access to the websites provided. Specifically at the American Stroke Foundation, we are continuing to keep in touch with participants and caregivers daily. This is through Zoom meetings, phone calls, texts, and emails. We also encourage reaching out to program coordinators with any issues or concerns that may arise. Here at ASF, we are a family and we encourage connection and want to provide caregivers and their loved ones with the best supports during COVID-19. As caregivers look forward, it is important to stay connected to loved ones, friends, family, and those that can provide social supports and outlets. It is also vital to keep to a routine and schedule in order to adjust to the new normal caring for a stroke survivor amidst a pandemic. This will give caregivers a sense of direction, a way to keep organized, and less stress throughout quarantine. It is also important to seek out supports and utilize them during this pandemic. With increased social isolation, often resulting in increased time spent caregiving and increased burden, it is important to have an outlet to be able to participate in activities important to the caregiver. There is no shame in seeking out help and supports during this time. By seeking out respite care options in person or virtually, this can be achieved for many caregivers. Caregivers should also take care of themselves during this uncertain and stressful times as well. Lastly, be prepared. It is vital to be prepared and have affairs in order in case you or your loved one falls ill. Having a binder or file in your computer with all necessary medical records, medications, schedules, insurance information, and legal documents for you and your loved one is recommended. Remember that you are not alone. There are resources to assist caregivers during this time, and as the backbone of the healthcare system, caregivers are incredibly important to this world and your loved one's own personal world.